So happy
Exactly.
National Women's Day to both of you. Just want to
Exactly.
say that.
Yeah, happy International Women's Day. Maybe I'll kick us off. So, hi everyone. Thank you so much for joining. Today we're really going to be, I think, covering all things kind of pelvic health and running. You have Lauren here from Uresta. So, for those of you who don't know Uresta, Uresta is a solution for bladder leakage when you cough, laugh, sneeze, jump, of course, run. It looks like this here. And we collaborated with Carolyn and Annalie from iRun a couple weeks ago, and Carolyn had written an article on how she was able to eliminate her bladder leakage when running, despite the fact that her physician told her that's something she would never be able to do without surgery. So that got a lot of interest with iRun and with Uresta, and we thought, why not dig deeper on this over an Instagram live. I know we have a lot of runners that use Uresta, and then of course, iRun is one of Canada's leading running publications. So we thought we'd jump on here. We'll dig deeper with Carolyn. When I first met Carolyn, it was like 2 years ago. She had like less than 2,000 followers. She has, I think, 140,000 followers now, and she shares pelvic health content, and it's really great. I highly recommend you check out her page after this live. So she's going to be talking about how she eliminated her leaks with running, but she's also going to be answering your questions. So if you guys have questions as we're going, write them in, and Annalie and I will try to capture them all, and we'll ask them towards the end. And then we're also going to be doing a giveaway at the end. So maybe before I turn it over to Carolyn, I don't know if there's anything you want to add.
You hit on everything, Lauren.
Perfect. All right. Well, Carolyn, I love your story. I love how you kind of got into this whole Instagram pelvic health world. So maybe if you want to talk about that before kind of digging into your tips and kind of your story.
Sure. Yeah, no, I'm super excited to be here, and I'm so glad that iRun kind of introduced this topic because you guys know this is something so close to my heart that I want women to stay active as they age. And I really felt that there was just such a lack of knowledge and access, even as somebody who's in the field. And so I just really felt like women need to know more about this. I think there's a lot more people suffering in silence that don't need to. If they just knew some simple things, some simple changes, other ways to exercise in a little bit of a different way, because it was so profoundly life-changing for me, right? Like, it was really life-changing when I couldn't run without leaking. And I know I talked about the emotional impact of that, and there's so many other changes you go through after you have kids, and you look for one piece of yourself that you can look back to. And when that kind of goes too, it's really hard. And I don't think a lot of people talk about it, and I'm very open about it. I love being active. If I wasn't into high intensity exercise, I may have never noticed my leaking was an issue. So I had a huge struggle getting to that point, but Uresta was very influential in getting me to that place where I was able to practice a lot of the skills that I shared specifically in that article and that I talk about all the time. And it gave me that confidence to be able to do so that I could get back to where I am today.
That's awesome. I think we're obviously going to recap some of your top tips on how you eliminated leakage, but a lot of it is habit building, right? So having the ability to rely on your Uresta and have it eliminate your leaks so that you can still work out, but you can focus on making those changes that a lot of them are very habit driven, right? And need to be kind of subconscious and happen as you're running, right? So
right.
Yeah. Maybe if you want to jump into kind of your kind of 8 tips and the main things that you focused on.
Sure, absolutely. So I kind of talked about it today in one of my posts, but this habit of perpetually going to the bathroom in this idea that if we get all the fluid out, like, we're not going to leak as we exercise. And it's a really common, rational thinking that you fall into with that. But we change the amount that the bladder can hold. We start to create more tension in that bladder as well, because the urine becomes so acidic that it's even more irritating. So it turns into this little vicious cycle, and also can lend itself to leaking with activity. So kind of just noticing that and trying to employ some changes. Now, maybe I wouldn't go running with a full bladder, but if I knew I was going to go for a run, I wasn't going 5, 10, 15 minutes, like on a constant cycle. I was going to wait until the very last second, and then I would go, making sure that I am kind of following through on a lot of those kind of bladder habit issues. I also noticed along the line of bladder irritation that my pre-workout was really irritated. So coffee, lots of beverages can be that. And I've just played around and I tried to see, is it coffee? No, I could run if I just had coffee, because there's days I don't do my pre-workout. And I just really started to notice that, because there's a high concentration of B12 in that was my personal trigger. So it takes a little bit of a science experiment within your own self, and kind of just starting to notice how things play out on days that you have certain foods and drinks. And it doesn't mean you're entirely getting rid of them, but it can be very situational. And I also think it just helps you highlight a little bit more, like, maybe I'm not weak. It's just really the fact that this food doesn't really interact well with me. And if you choose to still take it, that's okay, right? But now you know why the outcomes are as they are. So just that kind of heightened awareness of those things. I also, talk about breathing all the time. I changed breathing in daily habits, in my exercise. I incorporated it into running. I changed running form to better suit forces on the pelvic floor, and a lot of mobility as well, because we know that the hips and the inner thighs can play into what is happening at the level of the pelvic floor and its ability to function well. So it's taking all these things from the little tree and we put them together, and maybe one thing in of itself isn't making a big impact, but we put those things together. For me to see 90-95% improvement, like, hey, that's winning. That's keeping me away from surgery. It's keeping me doing what I love. Like, that is a huge win for me.
Interesting. And you did a post on this, I think the other day, on really kind of understanding, what diaphragm breathing is and how to better practice that. So I definitely recommend checking that out. I don't know if there's some kind of tips you can give just so people can better digest that, like what that actually means or how to actually implement it.
Yeah, I think diaphragm breathing often gets confused with belly breathing, and there is movement of the abdominal wall. However, it shouldn't be the only thing that's moving. So there should be expansion in just all directions of the ribs. And we can find restrictions that come from postpartum, from being pregnant, that we kind of need to focus on different positions to breathe in. Mm-hmm. But being able to do that all day and just releasing that abdominal tension, which will then create pelvic floor tension. If we can release that, it makes a really big improvement. And the same thing goes for running. Like, if you look at your belly button and it's not moving, like if you can videotape yourself, you're mm-hmm. holding your abs in really tight. And we can get stability from our breath with this really nice system that the diaphragm and pelvic floor works with. So if we can let our belly go when we're running too, I think people would be really amazed how that can change their pelvic floor's ability to respond.
I think that's really interesting that you're touching upon that, because I think for a lot of runners and a lot of women even who exercise, we think that we have to hold our abdominal muscles really tightly, really, want to hold them in really tightly. But that's actually the opposite of what we should be doing from what I'm gathering that you're saying, Caroline.
Correct. Yeah. It's something that's been perpetuated for a long time, and there's time and place for holding tension and when you're not. But during a lot of daily activities, we don't need that level, and that is kind of contributing to some baseline tension that we then carry over into other activities.
Talk a little bit about, for runners, how the two kind of work together, how that breathing technique and you're strengthening your pelvic floor muscles, how do the two kind of go together?
So really, when you think about how the diaphragm and the pelvic floor work together, they need to be in a stacked position. So if we're, we always talk about what's going on at the pelvis and at the ribs, but if we're misaligned, when that diaphragm descends, it's not equally accessing the pelvic floor to work together in this trampoline relationship. And so what you're really trying to think of is, if I can best get this to happen by addressing whatever strength or flexibility deficits are not allowing this to happen. If I can then just breathe normally and make that my regular habit, I shouldn't have to hyper focus on what's going on at the pelvic floor. And so it's kind of teasing apart what's going on. It's understanding how things work in your body and then addressing your deficits of strength or flexibility that are either causing the pelvic floor to do too much work, or maybe that it is weak, and how that goes together. And then you kind of insert that into running. Can you keep the diaphragm and the pelvic floor stacked during running? If you can, you shouldn't have to think about your pelvic floor when you're running. That natural trampoline and recoil, if you're breathing through the diaphragm, should really be all that you need.
Very interesting. It's interesting. I hear a lot of pelvic floor physiotherapists too just talk generally about like sucking in, like just like that habit all day that I think a lot of women kind of suck in, right? And how that can contribute to pelvic health issues. So I think that's super interesting, and kind of you start to realize how it's all related, right?
Exactly.
Yeah. So I think maybe moving on. So I think the next thing that you talked about was changing your running form. And love for you to dig into that a little bit.
Sure. So I've been a runner my whole life, like through grade school and high school, but not once had I ever thought about my running form until I started to kind of struggle with these issues. And I also stumbled onto the pose running method, and a lot of their teaching goes hand in hand with what actually biomechanically makes sense in the body. If we can get a slight forward lean, we're going to have a lot easier time stacking the diaphragm over the pelvic floor as we run, as well as the falling forward phase. You're always kind of catching yourself in a run, or reaching with your leg. And the pose method is more of just this kind of continual motion. And so you're then using a lot less muscular effort. And when those legs can fall underneath you, they're closer to your center of gravity. So there's less forces coming up your heel. There is less reaching through the muscles. The closer we keep things to our body, the better we usually do. So I really tapped into that and changed my stride and where I was striking on my foot, and found that I didn't have to think about it as much when I was able to stack those two areas in the body. And that lended a huge change as well. I can tell when I fatigue. I tell the people this all the time. I can tell when I'm going hard or I'm fatiguing, and and you just come up, it is so slight, but you just bring those ribs up because you're just gassed. And I can just immediately tell that change. And as I was working on things, that's when I would start to feel like leaking happen and all those other sorts of symptoms.
Interesting. I guess the next one would be stretches.
Yeah. So it's kind of, again, all these things are kind of teasing out what you need to work on in your body. I would say runners are notorious for tight hips and probably inner thighs. And I also have worked with a lot of runners, and as one, know that they also don't like to do a lot of accessory work. However, it's important to get you to where you need to be. And so tight hips can pull on the pelvic floor, as well as tight inner thighs. And because they all feed into one another as shared muscles, those can contribute to the pelvic floor's ability to work well or not work well.
No, go ahead.
Do you have a question, Annalie?
No.
Yeah. And strength training. So you talking about accessory work or other types of exercising to complement your running. You've talked a lot about, full body strengthening. And one thing I would say is Caroline has a lot of posts on exercises that activate a Kegel much more than just a Kegel would. So I think this is a really interesting topic, because I don't think people think about how you could be strengthening your pelvic floor with a lunge or other type of body movements.
Yeah, and muscles like to work in teams. They're called synergies, but that's kind of been a known thing. And I think that's the same for the pelvic floor. While there is value in learning how to access your pelvic floor in an isolated movement, such as a Kegel, for those who struggle with those return to exercise things, it really needs to be an integration to be able to get you there, and how they're working in these more complex movements when you're talking about breathing or creating strength. Running is a series of single leg strikes. So what is happening on a single limb at the pelvis? Is it stable? Is it not? Is one hip weak? Because to understand that, then you see how over 30 minutes, 7 miles, whatever it is, you can kind of start to see why, if you're losing strength, maybe at a certain endurance point, certain mileage point, or you just don't have it, you can understand how leaking can happen there. And no matter how many miles you run, that's not going to be addressing how we can get back from that.
Gotcha. I think the last couple of things that you talked about in your tips was, well, maybe first realistic goals, right? Like how, there's a lot of different steps that you can take to eliminating your leaks with running. How long did it take you to sort of see improvement initially, and then to be to a place where you were fully eliminating your leaks? And then maybe talk a little bit about how you used Uresta during that period of time.
Sure. So mindset is really huge. When I kind of got to like my point, it was, I don't want to do surgery. And so I'm going to try as much as I can. Right. So in that sense, I didn't give myself a time frame. It just was going to just be what it was until I could see what would happen. Versus in previous pregnancies and such, I'm like, oh, I didn't see much improvement after 6, 7, 8 weeks. I'm done. So for me, the consistency always going forward is what I think yields the biggest change. And also understanding that we're not just affecting strength, we're trying to retrain our brain and this automatic thing to happen. That takes time. It takes time to change a running form. If you've been a lifelong runner and you're trying to make these changes, those things take a while. So does breathing. So all of these things, just each of these one tasks takes a lot of time to make a change and then to combine them all together. So I think, one, not setting any rigid time frames, and also understanding and accepting that mindset, is particular to women who are postpartum. It took a long time for you to get there, right? It took 9 months of changes. It takes a long time to get back. And even if you're someone who's 20 years postpartum, like, we're trying to make a bunch of changes that you've been doing for a long time. And so just being gentle with yourself in that respect, and recognizing the small wins as they start to come along, because it's easy to get lost in that long-term, goal. Like, oh, I'm still leaking. Well, yeah, but you didn't leak for maybe the first 2 miles, or maybe it was at this certain intensity that you notice things start to change. So you really have to be your own coach in that sense, to just dial in and say, no, I think we are seeing some change, and it might not be exactly as quick as you would like it, but we're still making, movements forward, and then you kind of get to where you want to be.
Right. And I think that's so true. I think, we've talked about this, Carolyn, that pressure to get back into working out. I mean, took you 9 months to grow a human. It's going to take you some time to get back to a place where you can participate in high impact activity. Maybe just a little bit about Uresta. There was one question in here, which I'm going to tap it here to answer. I think it'll show up below. So, will Uresta just work as a crutch? I want to strengthen, but would just love to jump. So, I mean, I'm happy to answer that and would love to get Carolyn's thoughts on it. But I think first, just kind of understanding how Uresta works. Uresta, so this is Uresta. It inserts vaginally and essentially sits under the urethra and basically braces it under those moments of extra pressure. So if you're running or you're coughing or you're jumping, I always say it's like an ankle brace or a sports bra, right? It's extra support. It's not a crutch. It's not a Band-Aid. It is been through clinical studies, and we've never seen it worsen the muscle tone or make the condition worse. If anything, some women have actually seen improvement. And it can also be a great tool to manage a more mild prolapse as well, especially during high impact activity. So it's definitely not going to make your condition worse, but I wouldn't feel like, oh, it's a crutch. You're going to have to over rely on Uresta and kind of get yourself further down that rabbit hole. I don't know if you have anything you would add to that, Caroline.
Yeah, I just like to think about you just need to have a lot of tools in your toolbox, and there's nothing wrong with getting a little bit of support, especially in high impact activities. You might be great all day, but if it's running or it's jumping, like you just said, it gives a little bit of support. So depending on what your issue is, maybe you're strong and everything else is great, but you have some urethral hypermobility. The Uresta is going to give you support for that. For me, it fulfilled the role of letting me run without the constant like feeling of that leaking happening with each step, so that I could focus on the other things that I've talked about that helped me get there. And who knows, perhaps there's a role in the support that it provides. And as you're doing that strength training, does that help re-educate the body? I don't know.
Right.
I truly don't. But as far as seeing it as like a crutch, I see it as more of, as I would suggest, a pessary to somebody. It's another conservative option to allow people to live their life without surgery. And I'm not anti-surgery, but like those things come with risks, and they also have a shelf life of which, you know, they kind of need some revision. And so, you know, where you're at in your life, how old are you, what do you like to do, understanding that there's way more that goes into stress incontinence than just the tissue integrity and strength, because some people who undergo surgery still have these problems. It's because they haven't learned how to breathe and they haven't learned pressure control, and they've allowed that to be their crutch, and then that one doesn't work out.
Right. And I've heard surgeons tell me that as well, that it's not very, it's often, I don't want to say very, but it doesn't necessarily mean you'll eliminate your leaks during running, but the kind of everyday coughing, sneezing, it can be very effective for, of course. And of course, it's just great to have options. And, you know, however someone wants to manage their leaks, I've always said to people, like, you know, it's not, Uresta isn't a Band-Aid. If it improves your quality of life, I don't think that's a Band-Aid. There's so many different ways that you can manage your leaks, and this is just one of them. And surgery is one, and pelvic floor physio is one, right?
Yeah.
I mean, pads are one in theory, right? So there's a ton of different ways. It's whatever works best for you. I think so we have a few questions. If I've been trying to keep track of them in the chat. There is like a question button, so if you have specific questions, enter them there. That way we won't lose them. But one kind of thing I wanted to chat about was getting, which we kind of started talking about, but what are things to look out for when you're postpartum and you want to get back into running? And I think, Caroline, I think you chatted about maybe feeling like you got into running a little bit too soon. So would love to kind of know your thoughts, and maybe some alternatives too. If you want to be active, particular cardio, what would you recommend?
So you always want to look for any signs that you're just not handling your pressure well, which is leaking, pain, feelings of heaviness, falling out, those sorts of things. Return to running, there actually is a really great study that just kind of grades you on, can you do a lot of these single limb skills? And those are kind of designed to show us, like, do you have enough of the strength to, again, support that single leg stance on an ongoing basis? So that one is a really great one. And it can give you a lot of ideas for exercises to work towards and what you should be focusing on in those terms. So there are some really great markers for that. As far as progressing, running on an incline or doing hill running uphill helps promote that forward lean, which will also help you drive through the glutes, which is important in running. And so you can focus on the uphill portion, or you can hike uphill, and you just start to retrain the brain to kind of recall those things that we're trying to get it to do. And so even if it's hiking and it's not running, we're just trying to get back into that space. So there's plenty of things you can do to get back there. And I know runners just want to run, and I get it, and I've been there, but it's not worth it to start too early. So take it from someone who did.
And what, like, you know, alternatives like, you know, swimming or elliptical or biking, like, is it really just staying away from those activities that are super high impact, like jumping or running?
Typically, yeah. I mean, you want to make sure that you're ready and you can kind of cross those things off. So, you know, you can even do there's jump progression training where you're not actually leaving the ground, or maybe you are and it's just slightly, and you're working on what systems should be happening to get there, so that when I do add the real deal back in, you know, I'm there. And so even something like plank jacks helps in a more modified position, understand and how you tolerate adding back like an impact, and then you can kind of change the angle of that impact. And there's lots of ways to kind of work towards those like higher intensity stresses without it actually being that activity. So yeah, of course, running, cycling, ellipticals.
I like how
of
you've
that.
mentioned that the
Right.
different angles that you're sort of exercising on and how important that is, because folks I don't think about that necessarily. Can you speak a little bit more to how that kind of impacts and helps with the overall strengthening? You were mentioning uphill, downhill for running.
Sure. Yeah. I mean, so in terms of just different angles, we can make things easier or harder as we're progressing back into higher intensity. So you can always elevate yourself on a box and make the level of the plank or the push-up easier, right? And so we can still access those muscles we're trying to get with way less load. And so we can focus on proper form and the available strength that we have, and then slowly progress those in that way. And the same is true for running. You can do it in a safer way on an incline and gain that confidence there, then you can just start to transition to, to different flat roads, and downhill is super challenging. And so if you can gather all those other techniques first and then really try to master it in a downhill, you should really kind of train for all of those.
We did have a question come in, so I'm just going to share it here. So I guess they're asking, does Uresta fix a urethra prolapse? So I can chat a little bit about this, and Caroline for sure can jump in as well. So Uresta would help with a mild prolapse, so grade 1 prolapse, urethra prolapse included in that. Will it fix it? No. Will it relieve your symptoms? Yes. We've had a lot of women write in and say, I've been using Uresta for years with a mild prolapse and it's never advanced despite the fact that I have a very active lifestyle. So I think it's a great tool to help manage it, but it's certainly not going to fix it. I don't know if there's anything you would add to that, Caroline.
Nope, nailed it.
Okay, great. Another question we got actually before this Instagram live, which I thought was kind of interesting, was menstrual cups and period cups. Can it have an impact on your pelvic health? I think, and I've heard this a few times from women, concerns that it could worsen a prolapse. I'm really curious to hear your thoughts on this, or if there's anything to think about there.
No, I think I don't have the study in front of me, but I definitely know that there was one done that shows that there's no impact on the pelvic floor from inserting or removing a cup. I know that people with prolapse worry that suction does, but as long as you release it, there shouldn't be any impact on the organs or worsening of prolapse or the pelvic floor.
That makes sense for sure. But yeah, interesting. We've gotten that a couple times. I also had another question that came in before. I'm just going to grab it here. So this woman said she's had repeated UTIs since giving birth and getting a mild prolapse, which is about 2.5 years ago. Do you have any suggestions? She said that she's spoken with her doctor and nothing is helping.
So sometimes recurrent UTIs can be due to a tight pelvic floor that is not fully relaxing. And if we're not fully relaxing the pelvic floor when we go to void, then we can have some residual urine that gets captured in the urethra, and then we're ending up with a UTI. Tight pelvic floor muscles, if the culture comes back and it's negative, but you're still having symptoms of UTI, tight pelvic floor can mimic that and can just upregulate that tension. I think also if you said she has bladder prolapse, sometimes if there's a kink in the urethra, depending on how that prolapse is sitting, things could be collecting there as well. So sometimes it's teasing out what is actually happening. Some people find once they start doing exercises, if they have prolapse, that they then start leaking. And I always say that that's sometimes because you may have impacted that change in position a little bit. And sometimes when it sits in a prolapse, it kinks the urethra and you don't leak. And then we kind of change that and impact it. And some people see that change too. So that could be part of the reason.
Interesting. Okay, cool. Well, not cool, but very interesting to think through. It kind of makes sense once you explain it, why that might be happening. I did have just a quick question that also came in. Do we sell Uresta in the UK? We don't today, unfortunately. Maybe one day. Today we are just Canada and the US. We're currently available in Canada over the counter through our website. in the US, you do need a prescription right now, but we're in the process of changing that, let's just say. So stay tuned and hope to be available through our website in the US later this year. So fingers crossed. But I don't know if you had any other questions. I think
This definitely
this
was. I think we've
great.
covered off a lot of the topics that even came through from some of the folks with iRun. One of the sort of want to touch upon, or did want to sort of ask, someone had asked, you know, when it comes to the strength training or the strengthening exercises, is there a better time to be doing those exercises? Is that day before, after your run? How do you sort of want to time those sorts of things?
I mean, I would, on a consistent basis, to kind of yield that strength, but then I think going forward in maintenance mode, once you've done that, it doesn't really matter when you're doing it, whether it's, you know, 3 days a week that you choose to do it. I think before running, I would probably actually focus more on those stretches to make sure that pelvic floor is fully lengthened and descended, and the breathing exercises so that can fall into its more natural.
Totally makes sense. It's great. Some great tips and advice here for sure.
Yeah, absolutely. I feel like there's a lot of things that, you know, I think when you think about it are sort of simple and just things that we just don't, you know, you maybe didn't think about before, right? Before you had children, and then you get back into running, and a lot of it kind of makes sense once you hear the science behind it. And some of them are really simple things, right?
For a lot of women, and especially women who are active and running, and you know, you have your first child or your second child, and thinking about returning to exercising regularly, you kind of do think, well, it should kind of all come together fairly quickly. Runners are not necessarily the most patient, as you mentioned. Like to, you know, the strength training or the strength, it kind of it combines all together, and you sort of realize that, because if you continuing to run for a lifetime, that's super important to combine that stretching, the strengthening, all of it together.
Right. I even think just like the just in case pee, like I don't know how many friends now I'm like, don't you just in case pee? Like it is like pretty, I would say most women do it. Right. So I think and the amount of women that just tell me, oh, I just manage my bladder leakage by making sure I pee before I work out. It's just so interesting. Like logically you're thinking, well, less pee, less leaks, right? So it's really interesting to hear the science around that as well. Well, thank you guys. Someone asked if we're going to be recording this. We will repost this. And we also are doing a giveaway. So we're going to be giving away 2 Urestas as part of this Instagram Live. I'm going to post the terms with the post on our Instagram page. So you can check that out to figure out how to enter the giveaway. But thank you guys, everyone, for joining. I hope you have a wonderful, happy International Women's Day. And maybe we can do this again. There's lots of good questions and lots of engagement. So love to see it.
Awesome. Thanks, Lauren.
Thank you, Caroline. Thanks, you, Annalie.
Guys.
Thanks.
Bye, everybody.
Bye, guys. Bye.